Welcome to the Daybreak with Jeff Slakey podcast. I'm so happy you found us. Please subscribe, rate, review, and share this with your circle of influence. It's a collection of the interviews, news, and conversation during Daybreak with Jeff Slakey on iFiber One News Radio, KMAS, weekdays from 6 to 9. Good Monday to you. It's the 5th day of October. I'm Jeff Slakey along with Spencer Hughes. Good morning, Spence.
Hey, good morning. Happy Monday.
Happy Monday to you indeed. Today on the show, we'll have Dave Windom for our Sheriff Sit-Down, Mason County Health Director, talking about COVID in our community. In addition to that, more news on an outbreak that has happened at one of our long-term care facilities. Also, Dan Teuteberg is on to talk about 4-H week. It's this week. And first things first, though, what's going on with the weather for the week?
Well, it's going to be mostly sunny by the afternoon, a high of only 69 today, high of 69, low 70s tomorrow, and then it's going to be back into the mid to upper 60s for the rest of the week with rain coming pretty good starting Saturday.
Well, Friday afternoon, Mason County Public Health was notified of 9 additional Mason County residents testing positive for COVID-19, bringing the total to 461. Of that, no cases were connected to the current outbreak that State Department of Health, Mason County Public Health, Social and Health Services for the state, and Department of L&I working with Furlane Health and Rehabilitation to control an outbreak of COVID-19 identified at the facility in September. As of Friday afternoon, there were 47 cases and 2 deaths directly related to the outbreak at Furlane. All necessary actions to test, contact trace, quarantine, and isolate as appropriate are being done. Testing done weekly throughout the facility, including residents and employees. Furlane Health and Rehabilitation has implemented guidance from the State Department of Health and Mason County Public Health, including broader use of PPE, enhanced symptom screening for employees, and comprehensive testing for staff and residents. So as we get more information this afternoon about this outbreak and the rest of COVID-19 in Mason County, please continue to do what you can to help reduce the spread in our community.
Many Washington residents may be looking to take the chill out of these cool autumn evenings by using their fireplace, according to reports submitted by the State Fire Marshal's Office through the National Fire Incident Reporting System. Nearly 600 residential chimney fires have been reported in Washington state over the last 5 years. Chimney fires commonly occur due to buildup of a flammable byproduct of burning uncured wood that adheres to the sides of the chimney flues, creosote. Additionally, chimney flues may become obstructed over the summer months with animal entry, tree overgrowth, and or damper malfunction. Before lighting a wood fire in the fireplace for the first time this season, take some time to protect your family from chimney fires and unsafe chimney venting. The SFMO recommends residents have fireplaces and chimneys cleaned and inspected annually by a qualified professional to reduce these risks.
This upcoming Thursday, we'll be talking with Shelton Police Chief Darren Moody about a few things, including the search for a new chief. But the Shelton Police Department excited to launch books and badges starting today, a school supply drive in partnership with Graduation Matters to support students in the community. Back-to-school season looks different, but supplies are still needed. So beginning today, supplies donations can be brought to Smoke and Mo's, our community credit union, and monetary donations can be brought either directly to the Shelton Police Department or Peninsula Credit Union. This will go through November 20th, and all donated supplies will be distributed to local students in need.
And we, in partnership with ABC News Radio, will provide live anchored coverage of the presidential debates and vice presidential debate on the following dates. Coming up on Wednesday, the 7th, vice presidential debate at the University of Utah, Salt Lake City. And the start time is 6 p.m. We'll have kind of a pregame show, if you will, starting at 5 o'clock with a preview of the upcoming event and debate analysis following.
And yesterday, we had another exciting game on the air for the Seattle Seahawks here as they continue in. And they were once again looking pretty darn good. Russell Wilson threw 2 touchdown passes, and the Hawks improved to 4-0 with a 31-23 win over the Dolphins. Seahawks have started 4-0 just one time previously in history of their franchise. That was back in 2013, when they won it all. Wilson, who finished 24 for 34 and 360 yards, tied Peyton Manning's record of 16 touchdown passes in the first 4 games of a season. Jet lag and subtropical heat weren't issues for the Hawks. It was hot. Rare hot day in early October down in Miami. Seahawks play the Vikings this weekend for Sunday Night Football. Pregame at 3, kickoff at 5:20. Seahawks are presented by Shelton Health and Rehab, Riviera's Shellfish, South Sound Appliance, Dogtown Grooming, Neil's Pharmacy, and the Shelton Athletic Club. Again today on the show, Dave Windom, Mason County Health Director, for our Sheriff Sit-Down, talking COVID-19 in our community. And Dan Teuteberg stops in to talk a little bit more about 4-H Week. It's all here on a Monday. Good morning to you. Daybreak rolls on.
From the iFiber One News Radio studios, you're listening to Daybreak.
Well, good morning, everybody. Jeff Slakey and Spencer Hughes here on the Daybreak Show. This morning, during our Sheriff Sit-Down, we're going to kind of do a little bit of a different one presented by our Community Credit Union. Dave Windom is on the line for the county, our Health Director, Community Service Director, so we got a couple things to talk with him about. Dave, good morning to you.
Hey, good morning.
So first things first, we have a lot of COVID information to get to, but first let's take a pause on that for a second and briefly talk about the lifting of the burn ban restrictions.
Yeah, so we lifted the restrictions this week in conjunction, or actually we were after DNR. So Department of Natural Resources came out with a lifting of restrictions on burning early in the week, and then we followed later in the week. I mean, we had quite a bit of rain the week before. So one of the things we do when we look at changing any of our fire restrictions, either up or down, is we look at, it's called the fuel moisture content. And the primary one that we look at is the 10-hour fuels. That's the fuels that are basically an inch in diameter or smaller. Those are the ones that will burn up for 10 hours. And look at the moisture content. And last week, after the rains and everything settled, the moisture content was above 15%, which is in the green. And if you look at the 100-hour fuels, which are those up to like 8-inch diameter fuels, those were in the 30% moisture content. So those all look good. And the process kind of works where we look at what DNR is doing. We try to coordinate with DNR. It doesn't always happen exactly at the same time. But then we pass our thoughts around through the fire chiefs. So all the fire chiefs have an opportunity to have their input into raising or lowering the fire restrictions. And we kind of got away from using the word ban because ban had a connotation that just everything was off. And we went to more of a graduated response a couple of years ago and implemented restrictions in different levels. So early in the summer, we went to the first level of restriction was, large commercial burns, residential burns, things outdoors, large burn piles that would normally require a burn permit. We pulled those off. At the end of August, first part of September, when it got so hot and so dry for so long, that's when we started putting restrictions on campfires, and then finally we went down to some charcoal barbecue restrictions. And in using a graduated response, we can tailor those to times when we have like red flag times and make it a little more reasonable, I think.
The other hat that you wear for the county is, of course, the health director. And over the course of last week, we started to hear more an uptick in cases. And it appears there is a long-term care facility in the county that maybe is directly related to many of these cases. I know there is a lot of HIPAA privacy concerns as contact tracing and more conversations are being had to find out who may be in contact with those who are now testing positive. But other than that, what can you tell us about how Mason County has been with COVID over the last few weeks or so?
So the last few weeks, we've had some really good progress. We look at the rates of COVID per 100,000 per 2 weeks. So if you think of that, so one of our key numbers is 75 cases per 100,000 per 2 weeks as a threshold when we start looking at how do you reopen schools. And that it takes us from high category into a medium category. And if we get below 25 cases per 100,000 per 2 weeks, that puts us into a low risk category as a county, and that allows us to move even further in getting kids back to school into an in-person, face-to-face learning situation. So we're making some pretty good progress on that. It's not the only metric we look at. We look at how many beds are occupied in the hospital. We want to keep that below 80%, so we have some reserve for COVID cases. We look at the number of COVID cases in the hospital. We want that to be fewer than 20% of the beds with COVID patients. We've met that criteria, so we're doing well on that. It's right now for us, it's pretty much that cases per 100,000 that's a little more difficult to get to, and it just takes time. The other part of that is the positivity rate. So we want to get down to 2% or less of tests come back as positive. So we're not quite there yet. We're running around 3.5%, 4% positivity rate. And I think those will be coming down shortly too. I do have some concerns as we go into the fall and we start having flu season coming back. And when you look at what COVID is like, it is like an influenza. It's nearly impossible to distinguish between A and B influenza. So this fall, we're going to be testing for all three at once as we get into, Thanksgiving, family gatherings, Christmas family gatherings, those sorts of things. The other thing we have coming out, you'll be hearing in the news probably, is the COVID vaccine is looking to come out. There are 5 different ones that are being proposed or are in the last stages of trials. And that we're getting from the feds is the first one may be available in limited quantities in November. So we're waiting. That a lot of that's going to be driven by the federal government as opposed to state government, but it'll kind of flow Fed, state, us.
And then on those, it's first responders, folks who are right involved with the care of others who have COVID for that vaccination. It's not going to be everybody across the whole county.
No, it'll be a tiered approach. So it'll start off with the first responders and direct medical care folks in order to keep our system up and running. And then as the other vaccines come online, that will spread out to greater parts of the population.
Dave Windom is the health director, also acting as the fire marshal, as we covered a couple different things here this morning. As more information comes out about COVID-19, of course, the phone lines are open, Dave, to give us a call back, and we'll talk about these things, reporting on this, making sure folks are doing what they can to help reduce the spread of COVID in our communities. But we'll continue to hear more information come out from you, and I'm anticipating and encouraged to hear more conversations that you and the superintendents and the school districts are having about possible reopening down the road and things like that. So the Sheriff Sit Down today with Dave Windom is presented by our Community Credit Union. Thanks, Dave.
Hey, thanks much.
You're listening to Daybreak on iFiber One News Radio.
Well, good morning, everybody. Jeff Slakey and Spencer Hughes on the Daybreak Show via Zoom video conference from Turning Pointe Survivor Advocacy Center, the Executive Director, Gina Blanchard-Reed. Morning, Gina. How are you?
Good morning. I'm doing very well. Thank you.
Turning Pointe is online at turningpointe.org. We'll put the links to that in the show notes. So a great organization that does a lot in this community and one of the largest survivor advocacy centers in the state. Today marks a great start to a long-time fundraiser, but because of COVID, things have changed a little bit, and Power of the Purse is all week long starting today at 9, right?
That's right. So it is a week-long virtual event that's going to culminate with a live-streamed event on Friday at 6 o'clock. Also, just wanted to point out real quick, I forgot to mention that we are celebrating 20 years in the community. So it's kind of a celebration for us.
That's great. Many lives have been touched and helped by Turning Pointe, and now is an opportunity for folks to help Turning Pointe themselves. So let's talk about how this kind of hybrid Power of the Purse is going to go through the week. I'm excited to be a part of it Friday night, but from now until Friday, how is this all going to work out?
So it has been sort of interesting changing our platform, and but we have been just so humbled by the outpouring of the business community. And so we've procured some wonderful items that will be available for bidding, buy it now options that will also be available. And people can start shopping and bidding, right after this program. And we'll have a link to a portal that they can access through our website or through our Facebook. And they'll be notified. They'll go on. They'll register. They can vault their credit card. And then if they see something, they can bid on it. And if they get outbid during the week, they'll get a notification through text or email, however they choose. And so they can kind of have that adrenaline going all week and culminate again with a Friday event where the auction will close.
And this fundraiser for Turning Point is the main funding arm for the whole year for Turning Point. What are some of the ways that the monies that have raised have helped over the last years?
Right. So it is our only event that we host, and an opportunity to showcase what we do as well. But last year, we had a very successful event, and the money that was raised went towards our new youth program, which is up and running now. We have hired our youth advocate. We had some renovations done in our shelter, and thanks to Green Diamond, and also the money that we raised at Power the Purse to pay for those things that our federal grants weren't paying for. So we actually are seeing youth and children in our shelter in a way that we haven't before, and really serving those youngest survivors. So this year we're going to build upon that and grow that program up in the Belfair area. So a lot of the funds that will be raised will help that effort as well.
We talked early on at the start of this, March or April, about the need for centers like Turning Point. It is often a dangerous situation that people find themselves in abusive households. And because of these quarantines and stay-at-home orders, there's a lot of concern over the last few months about how that is working with families with those types of struggles and issues. Is that still the case? Has it subsided at all, or is it worse?
No, it actually hasn't, and we're hearing from local law enforcement and others that the calls are up as well. We're seeing our call volume up, and unfortunately, we've had to, because of social distancing, we're not able to be at full capacity so that we can keep our clients and our staff safe. But so we're definitely bringing in those people in imminent danger, and so the cases that we're seeing right now are more critical, and so we're just thankful that we have staff that's healthy and willing to make sure that our clients are safe as well. So yeah, it's very hard for some people to be at home in very stressful times, and times that where they really have no place to go. And so those situations escalate for sure.
You can always call or text their 24-hour crisis support line at 360-432-1212. And also turningpoint.org for the website has got information on this as well. But that is an important number to know, to reach out. It's safe and secure, and the help in some form will come and be able to at least contact with you and talk with you about maybe next steps. So starting just after daybreak ends, so 9 o'clock this morning, the links will go live for the virtual week-long Power of the Purse auction items, and it'll culminate again Friday in the evening with a Facebook Live event on the Turning Point's Facebook page. And I'm really excited and thankful that you asked me to help out and be a part of that. So it's always good to be involved with Turning Point. Gina Blanchard-Reed, the executive director, here on the air with us today. Again, turningpoint.org. Find the information. You can always Google to Turning Point Shelton, and gets you right there as well. Gina, good to see you. Thanks for continuing to do the great work of survivor advocacy in our community. And I know Turning Point is one of the premier centers in the state that helps many, many folks.
Thank you for the time. You have a good day.
From the iFiber One News Radio studios, you're listening to Daybreak.
Hi, good morning, everybody. Jeff Slakey and Spencer Hughes on the Daybreak Show via Zoom video conference this morning. We're going to be talking about 4-H. Dan Teuteberg, good morning, sir. How you doing?
Good morning. I'm doing great. Thanks for having me.
Good to see you. Good to connect with you and catch up. 4-H is a wonderful organization. You and I have talked about it over the years. 4-H.org to get to the main 4-H website. There's also the 4-H Youth Development in Mason County through the WSU Extension Office. And you've got a lot of fun things planned, not only for this week, but the first of this month here started kind of your new year. And so there's a lot of stuff to look forward to.
Yep. October 1 is the start of our 4-H year. We look forward to lots of things coming ahead. It's a unique start of our 4-H year. We're not meeting face-to-face currently. We're meeting virtually. So clubs are making plans to keep meeting virtually through Zoom and things like that. But we're celebrating 4-H week regardless. We did a commissioner proclamation last week where we talked about the benefits of 4-H and the support we get from 4-H from our partners, and that was a wonderful thing. One of our exciting pieces coming up is our Tractor Supply Clover Days. That starts on October 7th. You can buy a clover online or face-to-face in the store, and all those funds go to support youth leadership programs within 4-H locally.
So what are some of the things with the social distancing and more kind of like this, via Zoom, that are the 4-H members going to be able to do, and how has that interaction been over this last few months?
It's been a learning curve. 4-H prides ourselves on hands-on, face-to-face experiential learning, so we've had to adapt to that pretty well. We offer project Zooms, where everything from horses to dogs to baking to robotics is going to be offering project Zoom learning opportunities, so kids can learn with their leaders at home through virtual presence. We also have a neat opportunity we're calling 4-H for You. We're creating project-based kits where in September, we did a Surviving a Zombie Apocalypse series, disaster preparedness. So in there is a curriculum lesson plan. It walks people through how to survive a zombie apocalypse, but really it was lesson plans on safety and what to do for safety reasons. But in that kit are hands-on things, and one of them was creating a survival bracelet where we created that, where they can take it home and then recreate that. In October, we're doing the Crime and Science series. So kids can learn invisible ink, fingerprinting, DNA extraction, things like that. And those kits are all free. We're doing 40 bags per month. So you have to sign up, and you can do that on our website.
We'll put the links to that in the show notes. And 4-H, of course, like as you mentioned, it's a lot of hands-on things and the robotics and stuff, but it is kind of encouraging to hear that you're able to adapt a lot of this stuff. When you're able to get back together, does it look like, Panhandle next year, or when are we going to get back to, normal is kind of out the window. We understand that. But as we figure out social distancing and stuff, are those types of memories that folks have of great 4-H camps still going to be applicable? It's just a little different?
Yeah, there's movement being made now at our state level to look at what does reopening happen and when and how. I'm excited that I've been able to serve on that committee at the state level. Our plans were submitted to leadership at WSU to get permission to move ahead. So there is headway there.
Good.
We're no longer only waiting for phase 4. We're going to be looking at how to do things safely for our community, for kids and our volunteers. In terms of summer camp numbers, those are hard because you're talking 200 plus people in a really confined space.
Yeah.
I'm thinking we're going to start more calculated, smaller groups of 5 or less and things like that once we get the okay. So I'm excited for the new year because that means we can get started on the projects and things, get our framework. And then when we can reopen safely, it's going to happen over time. Very, very calculated.
How can parents get their kids involved with 4-H in Mason County? And is there the need with this kind of remote way it's been working for more volunteers, or are we just looking for kids to be able to utilize these resources?
We're always looking for volunteers, and we're always looking for new members. You don't have to be a 4-H member to participate, but we really, really encourage it. There's good opportunities when you're a member of our program. You can join and get more information by visiting our website, talking to Kathy Fuller. She's our program coordinator, or myself. We'll walk you through the steps. Our website is extension.wsu.edu/Mason. and then you can get more information. We're on Facebook too, but all you got to do is kind of click around or give us a call, and we can get you connected with the 4-H group, or you can start your own. You can participate in those project Zooms. You can participate in those monthly series, 4-H for You, things like that.
I know that the 4-H has been a real impactful organization in my family. My dad was a big-time 4-H member and then did some, I think, camp counseling down in California later in his life. It's always been something that he really has talked positively about. And every time you're on or Kathy's on, you can just tell how passionate you are about the programs, 4-H in general, and the kids that you're able to help. So you mentioned those websites with the WSU extension, 4-H in general, 4-H.org. We'll get those links as well, and to the Facebook page so people can find those things. Dan, it was good to see you.
Absolutely. Good to see you too.
One of these days, we'll maybe do this in person.
That would be great.
And have a fun 4-H week and have a great year with 4-H.
Thank you very much.
iFiber One News Radio, 1030 KMAS and FM 103.3 presents Daybreak.
Good morning to you. Daybreak rolls on here on this Monday, the 5th day of October. Good morning, Spencer.
Hey, good morning to you. What's going on?
Well, today is National Do Something Nice Day. It is very similar to National Random Acts of Kindness Day, but especially now with a lot of things going on in the world, today might be a great day to do something nice for others. I know this kind of is right into your wheelhouse with your positivity stuff, mindfulness, law of attraction, and this is a good day.
Yeah, this is, especially since jokingly yesterday was International Toot Your Own Flute Day, where you got to be selfish and only think of yourself. That was yesterday's day. So it's followed by Do Something Nice Day, which, one thing I want to add to this is that it's easy to do something nice to our spouses, to our kids, to people we work with, people we like. It's a little harder to do something nice to like a random stranger, someone we might not know, or even somebody who hasn't necessarily been kind to us in the past. Maybe that's an extra challenge today for Do Something Nice Day, because it's always easy to be nice to people we like,
For sure. Some of the things that you could do to a stranger, perhaps, is starting early this morning. If you are driving on the road and you see someone signaling in traffic, why don't you let them over or merge a little more nicer, I guess, is another way to do it. Picking up the neighbor's newspaper on a daily walk and placing it within easy reach. Make sure you have a good relationship with your neighbor before you start doing that, I think.
And people like compliments, Some
of the other
you see them wearing a nice shirt you like or something, or maybe they pulled up in a nice car or something, say something.
Yeah, give them a compliment, or the way the mask fabric they have, or something like that. Making sure too, I guess, doing something nice during COVID would be, giving people extra space, or making sure that, you're doing what you can to help reduce the spread. Read to a child is a good one on Do Something Nice Day. Either read to a child or listen to a child reading. Kaiser, we were reading last night, and actually yesterday he went over to one of our neighbors' house, and they were sitting outside, and he read to her, and she's just a few grades older than him. I thought that was pretty good for him. Sometimes when you're learning to read, your confidence level, especially to be reading to a peer, but
that's awesome.
Seem to do fine. Listen to someone who is lonely. That's a good one too. If you see someone sitting around, mask, make sure you're distanced and spaced, but maybe you can have a conversation with somebody, and maybe that's in itself is doing something nice.
Yeah, and kind of the old traditional too, buy someone a coffee or, something that the person in line behind you, maybe surprise them at the drive-thru when you're buying a cheeseburger or something, and you always hope that they're not buying for 20 people at home, right?
Sure.
I'm just kidding.
Sure, I'll buy for the person behind me. Oh, great. That's $200.
You're like, boy, there better be some good karma coming back for me.
I meant the person behind that person.
Yeah. The one getting the coffee?
So it doesn't take a lot of time.
No.
Seconds can change someone's mood today by doing something nice. Hope you have a great day today and do something nice or receive a nice well wish from somebody. More Daybreak is coming up.
From the iFiber One News Radio studios, you're listening to Daybreak.
And good morning, Spencer Hughes and Jeff Slakey here with you for a Monday Daybreak. It's the first Monday in October. It's the 5th. And in the United States, National Child Health Day occurs each year on this first Monday in October. And it's a day to recognize the care and guidance children need to grow strong and healthy. Of course, every child deserves to be the healthiest he or she can be. Everything from the food that they eat, to the words they take in, to the educations they get, to all sorts of things. There's different things that add up to a child's health. Children require support and opportunities to grow. Parents often worry about chronic disease, accidents, childhood illnesses, and also at the same time we can focus on a child's mental health and general health as well. A lot of people think of health and they think of catastrophic things like cancer and other ailments and illnesses, but sometimes it just boils down to the happiness of a child, the well-being of a child, the general health condition of a child. Whether it's their environment, the food they eat, or how much TV they watch, today is an excellent opportunity to support the children in your life, be it your own children, grandchildren, nephews, nieces, whoever it happens to be. How to observe Child Health Day. You might go for a walk, do some yard work, or participate in activities to promote child health. Other ways to participate in the day include scheduling your child's next routine checkup. When was the last time they went to the doctor? Ensure that vaccinations are up to date. As many kids started up school recently, of course, the schools will let you know what vaccines they need. Maybe one slipped by, you missed one that you thought they had. Schedule a routine dental checkup. That's been a little bit harder during COVID because a lot of dental offices have not been doing things like routine cleanings as much as emergency things like crowns and things like that, more catastrophic things with your teeth. But schedule a routine dental checkup when you can. Add new healthy activities to your children's routine. Maybe get them outside a little bit more. Set an example by letting your children catch you doing healthy things and engaging in healthy habits, right? Because they see what you do and they will mimic what you do, and they're like sponges and absorbing every day. Inspect your child's toys. Make sure they're age appropriate and not broken. Especially for the younger kids, there could be a danger involved. Share your best tips for helping your children live in a healthy lifestyle. And while you're celebrating, be sure to use hashtag Child Health Day to post on your social media. I'm Spencer Hughes with Jeff Slakey. Thanks so much for listening to Daybreak. It's a Monday, October 5th, and more of the show is coming up.
Thank you so much for listening to today's Daybreak with Jeff Slakey podcast. Again, I'm so happy and honored you found us and chose to listen. Please subscribe, rate, review, and share this with your circle of influence. It's a collection of some of the interviews, news, and conversation during Daybreak with Jeff Slakey on iFiber One News Radio KMAS, weekdays from 6 to 9. Thank you so much again, and talk with you next time.